Hey guys, we just landed here in Seattle, Washington, our beautiful Northpoint, Washington facility. First of all, we just want to say thanks for joining us on this journey. Anything you want to say real quick, Big Jon?
Appreciate the support, and we got a lot of great episodes coming your way, so be sure to check them out, show us some love on all the different media platforms, YouTube, podcasts, all that good stuff.
Spotify, Stitcher, iTunes.
Absolutely.
Next few episodes are going to be showcasing our amazing Northpoint, Washington staff, as well as some of the alumni that have graduated from this facility, as well as Northpoint, Idaho, that live in the Washington State area.
Yeah, it's going to be a real good time,
guys. Welcome to No Way But North, where we talk about the miracles of recovery and the tools used to achieve them. My name is Cooper Lyons. My clean date is November 27th, 2010. And
as always, joined by me.
As always, I am joined by Big Jon Meldrum, a.k.a. Chocolate Bear, a.k.a. Black Paul Bunyan, a.k.a. Pastor of Disaster.
Ooh, I like that one. Every episode we
we're going to add another one on.
A.k.a. Never mind.
You couldn't think of one.
No, I had one. AKA, we go deep.
We do go deep at Northpoint, Washington.
The Northpoint, Washington, we go deep. for Logan.
How are you feeling on this fine, cloudy Seattle Sunday morning?
It's cloudy in Seattle every day.
I know. It's a cloudy Sunday Seattle morning. How are you feeling?
I don't know yet.
No? Haven't had enough coffee? Or water? Whatever's in that?
Agua?
I
don't know. I'm a little delusional, bro. Like
a little tired?
A little tired.
All right.
A little tired, but like we're gonna get through it.
Yeah.
We're gonna rock it. You know,
you're gonna wake up and
I've got a slew of like
conversation.
energy drinks and empty coffee cups over to our right.
Off camera.
Like, I mean, I would have them on the desk, but I don't think we have like.
It's not aesthetically pleasing for the producer back there.
Well, we don't really care what Alex wants. I love you, Alex. Hey.
All right, guys. Well, before John starts a fight with Alex, we're going to introduce our guest. Logan is the vice president of the Washington market up here in Northpoint, Washington. Yep. You've been working.
He's the Erica Lopez.
The Erica Lopez of Washington.
Erica Lopez is the Logan.
Oh no. It's definitely the other way around.
Smart man.
I'm the half
I don't think
Erica
she
Lopez.
watches these, but cover your ass.
Erica Lopez.
And how long have you been working in the healthcare industry?
So I started in healthcare in 2005.
Okay.
As an administrator in training here in Washington.
Wow. It's almost 20 years. No, 15
15.
years.
2005.
Yeah.
How old were you?
I was 22 years old.
I just graduated high school.
Yeah.
So
I'm all about making our patients feel old.
Went right in. Yep.
Very nice.
Went deep right
off the bat.
He just went deep
right off the bat.
All right, guys. Well, we're going to get into the quote real quick, and I like it because it's a classic. If you're going through hell, keep going. Winston S. Churchill. Why'd you bring up that quote? We were kind of talking about that a minute ago, but let's hear it again.
Absolutely. So, I think one of the most important things in life is just figuring out and learning how to persevere. And I love that Winston Churchill quote because I think that, very succinctly sums up how you have to sometimes get through challenges in life. Mm-hmm. And, my job, healthcare operations in general is no different. There's always a lot going on. There's always a lot of things that you have to just figure out a way around and how to work around them and work with people to accomplish what you're trying to do. And sometimes perseverance is like the only thing that's going to get you there. Yeah. And then also thinking about, this job now and working in recovery with other folks, it's definitely something that I see our patients having to do. They have to persevere. They get,
to say the least.
Yeah, they definitely have some struggles, and they just got to manage through it and try to figure out how to get from day 1 to day 2 to 3 and on.
I like it. Big Jon Meldrum. He makes me read them twice every time. If you are going through hell, keep going. Winston S. Churchill.
I'm having a hard time relating to this quote.
Really?
Yeah, because if I was in hell, I would give up. No, I'm just playing.
That's the point, John. John, I'm sure you've been through some stuff.
I have. No, I'm just playing. I was just thinking like flames around us. Like I'm like, I just want to lay down.
It's nice and warm.
It's nice and warm.
It's funny too as I think about that quote. It almost sounds like pessimistic maybe because it's kind of the idea is like life can be a struggle.
Yeah.
But I'm inherently like an optimist. You know, I actually think about.
It's one of the things I hate about you.
Lots of people do. Trust me.
I appreciate it.
Plenty of people, you know, they're like, Logan, you know, do X, do Y, you know, and I'm like, no, I just love everybody. I think that person, you know, is great, and I'll find that characteristic in them and bring that
Like
out.
the world's falling down around us, and Logan's just like, yeah,
Everything's fine.
Is that why you and Tucker get along so well?
Probably, yeah. We are both very optimistic.
No. When I think of the quote, though, I mean, it's kind of the same thing, just persevering through the hard things and knowing that it's not going to be a forever thing.
That's right.
Yeah. Yeah, no, for me, I mean, you guys said it, right? Because all you can do is keep going when you're in it. Like, you can't just sit there and not do anything, or you're just going to stay there and in the hell you're. Yeah, exactly.
Yeah. Don't wallow in it.
Yeah. So for me, though, I'm trying to think of something original, right? And the thing I'm thinking about is perseverance isn't necessarily I continue to bang my head against the wall, right? Sometimes it's taking a step back, looking at where I need to keep going, and picking the right path instead of the left path, and it's not just keep running through hot flames. And maybe there's a nice grassy walkway to the right, and that's how I can persevere. It's going to be easy that way.
Gain a new perspective.
Exactly. Yep. So guys, before we forget, make sure you hit that like button, that subscribe button, share this with one person or your entire Facebook feed. Make sure we get these messages out to as many people as possible so we can help as many people as possible. Guys, we're going to be talking about accessible healthcare. It's not the most glamorous topic, but I think it's probably one of the most necessary
you just
topics.
like shot his...
No, I'm just saying it's
not
like,
the most glamorous. Don't watch this because it's not that interesting.
Everyone, this won't be exciting.
Well, I mean, we hear stories about people telling their story through addiction.
You've already reloaded that gun and shot yourself in the foot. Sorry.
Shovel.
I apologize, Logan. Not that it's not exciting.
I mean, he's already dug himself a hole because he's wearing a Seahawks jersey.
Oh.
I was wondering if we were going to just be able to.
I thought you would make it through it, but I guess not.
I mean, I will show you some. Isn't that a Marshawn Lynch jersey?
No, it's not. It's an Earl Thomas jersey.
I don't know.
Even though he's gone with Baltimore, I'm still going to rock it. I'm praying he comes back.
Maybe he'll see this and we'll have
That's
a
right.
change of
I'm going to
heart.
buy you a
Come on,
Marshawn
ET3.
Lynch jersey and send it to you.
I burned mine.
All right, so getting into accessible healthcare. Sorry about that rough transition.
Oh, we're just having some friendly banter.
I like it. So, I mean, obviously, accessible healthcare is pretty self-explanatory. But what does that actually look like? There's a lot that goes into that, not just being able to walk into a doctor's office, right? So what does that actually mean, accessible healthcare?
Yeah, it's a complex topic for sure. And really, it's kind of the root of everything that we try to do in operations, right? So, you've got patient X in the community somewhere that needs something, right? And so, for one, they need to be informed. They've got to understand what are the options out there for me that I can go to. And that's, whether it's you need a heart surgery, you need treatment, you need, anything really. You've got to figure out what's available in terms of services. But it's really tough for consumers to really kind of navigate that because it's also a payer environment. So the payer can determine where you go in network, out of network, and then the actual provider of the care itself has to have a contract with that payer so that they can either be in network or even work to get out of network benefits established for that person to seek treatment there. Yep. So what it really means is like, how do I identify my situation, my problem, my need, my disorder, whatever it is, and then visualize where I'm going to go to get that need met. And that's about as simply as you can put it. But
yeah, I was going to say, I'm sure it's way more complicated.
But it's really complex. And so I think that the tough part is educating people about what their options are, and then making sure that they can connect the dots on how to get into that place, what that's going to look like, what that's going to cost them, what impact it might have on their life or their family or their job, and then just trying to help them work through that through some good case management so that at the end of the day they get their need met and they don't have to throw their life into upheaval.
Yeah, well, and I think it's right because the people that really need healthcare often they're not the best off financially.
Right.
And so they're kind of in that fight or flight mode, right? That survival mode. And if they don't have something that's immediately pressing, I need to go to the hospital now,
Right.
then they're not worried about educating themselves about which insurance they should get and what services are provided to them. And then that usually, I'm assuming, detriments them later on.
Yeah. And most people, I mean, there's a ton of studies done about it, but most Americans really do wait until there's like a significant need. And by then it's sometimes even too late. You know, when we're talking about like heart surgeries and things like that, you know, a lot of times people wait until it's just way too late. And then by the time they actually do navigate the system and figure out how to get the help they need, that's, you know, that could take weeks or months for them to actually get that care. So I think it's really upon us, like the onus is on us as providers of care to figure out how to educate the masses on what to do if a situation comes up where they need that support and do it ahead of time before it becomes too late.
Yeah, being prepared, right?
Yep.
Prepare for the worst, hope for the best. And then, so what are some of the other detriments of not having access to healthcare other than, I mean, like we just talked about, right? If you don't have health insurance and you can't get to a provider and you're having a life-threatening thing,
Right.
what are some of maybe the more macro level detriments to economy or anything like that?
Absolutely, yeah. I mean, and when I think about, you know, what we do here, right? So Northpoint, Washington, we're a co-occurring program, substance use disorder and mental health. This didn't really even exist in Washington until we came here, you know, in April 29th when we opened. So you have a group of people that have been needing that level of care and that service in our community. They've been going out of state really to get that type of care met. And, you know, that's expensive. So what that does is in the long run, that total cost of treatment for that person went through the roof, and that costs the insurance companies more, which makes them upcharge their premiums on all other members, you know, year over year. And so it does have kind of a drastic effect on everybody. If you do not provide care that's needed in the right place at the right time, at the right level of care, then, you know, everybody is going to pay for that in the end. And the federal government will end up having to, you know, support that in the end as well.
Yeah.
So.
Well, and even the local Seattle community, that money was taken out of the local Seattle community.
Yeah.
So
Absolutely.
yeah. Okay. So anything else? Any other kind of large scale detriments? Anything like that you can think of off the top of your head?
Not necessarily detriment. I mean, I'm again optimist. I'm thinking about what can we do to not just, you know, be, you know, admiring a problem, right? So lobbying is really important. We've got to make sure that our legislature has a good, firm understanding of what it is that our communities need. And so, you know, we spend a fair amount of time in Olympia in contracting with groups that do lobbying efforts that understand how to navigate just the hill, right?
Yep.
Because that's complex in itself. So spending time with people who can legislate and make a difference for how, you know, the laws get created and then it impacts the community, that's really important. So we go down and we talk to them about if they're going to pass legislation that will impact access to care or to affordable care in particular. We want to make sure that we weigh in on that and have a voice in that conversation.
Yeah. Well, we were talking with Brandon Johnson the other day. I don't know if you've met him. He's another.
I know of Brandon.
Him. Yeah. So he was talking about the importance of that too. He's done that all last year. It was like there was, I think he said three major healthcare laws. Three. And he's just talking about, you know, these legislators, they want to help with addiction, but they don't. Sure. They're not very educated. They don't have a lot of experience with it. So going down and just sharing my story or telling them about it, that made a huge difference, and the laws all passed unanimously.
Yep.
So yeah, I think that's really important. And I mean, I don't think a lot of people really think a lot of people don't have faith in that process. So, but actually doing it and seeing things happen.
Yeah, I mean that's the place where you really have to start a lot of the time. You know, it's one thing to educate a population, but if the laws aren't on their side, you know, or the payers aren't on their side, then having the education doesn't do them a ton of good because the access to the treatment still doesn't exist.
Yeah. So speaking of that, what are some other roadblocks that somebody's going to be facing right now to be getting treatment other than, you know, poverty, lack of education?
Yep. And so a lot of the times it's like a physician, right? So they want to work with a certain doctor, that doctor may or may not refer to a location. They have established relationships, potentially with another location, and they want to send the person there because that's what they're used to, that's what they're comfortable with. And there's nothing necessarily wrong with that, but I think healthcare is extremely individual. And so everybody's situation is a little bit different. And if, the physician or the provider network can take the time to really understand that patient and their specific needs, then it makes it a lot easier to make sure they get connected with the type of care that they actually need, versus just kind of lumping people into a group and saying, okay, you have an addiction disorder, so we're going to send you to X location. X location might not actually do what that person's individual needs are. It might not meet those needs. And so that's something that's really critical, is for the providers to be educated about what's available, and for the patient to kind of advocate on their own behalf to make sure that they're getting what they need.
Yeah. No thoughts?
No.
No? Sorry, I thought it sounded like you were going to say something.
No, I mean, like this, it's kind of out of my realm when you start talking about insurances and stuff like that, providers. And
Is that why you get scared and you get emails from Amy?
yeah.
Right. And definitely I'm not like the end all be all. In operations, my job is to kind of know enough about everything to have some kind of a voice.
Just enough education.
Just enough. Yeah. But then I lean on folks like Amy all the time, or like Janice.
It's definitely
to
like a very
navigate that.
vast topic of just, there's so, when you start talking about insurances and stuff, and that's why, like with my staff, I always tell them, like, anytime insurance questions come up, insurance or in-network versus out-network, or what they're going to be covered or whatever like that, I'm always like, don't answer that. Don't say anything about that.
Yeah.
Contact Julia or Brett or Bree.
Yeah.
Contact one of them.
Well, and as somebody, I've sought healthcare for myself or for loved ones.
I still don't even know what insurance I have.
Right. I mean, you're very much in the norm.
Yeah.
I mean, if you talk to the average person, you say, what's your insurance, and do you know where you could go if you needed this type of treatment? Most people would be like, well, I have no idea.
I know what my deductible is.
Right.
And that's pretty much it.
So I asked, I'm like, what's the best one? They're like, this one, but it has a higher deductible. Which one do I have to pay less for? This one. I'm like, okay. And then I don't have shit for coverage.
And I think
die.
I definitely spent a large amount of time in our old human resources person's office trying to understand what exactly I was paying for every month, and I'm like, I have no idea. So that's why I think this is a really important topic. So I don't know if you even want to talk about this. Someone's outlook when they do have access to treatment, obviously it's exponentially better.
Yeah.
I mean, is there anything really more you want to say about that, other than it's just their chances of recovery or in any way, shape, or form are better?
Yeah. I think, it goes back to perseverance again. So whether you have access to care or not, I mean, that's the easy question, but it's really, do you understand how to access care? And that's where perseverance really has to come in, because, you make a phone call to an insurance company, you might wait on hold for an hour, and then get transferred 4 times. Some people are just like, hey, I've got to, take my kid to soccer or something, I don't have time to even do this right now. And so they end up just neglecting that need. And so the access may exist, but it's just figuring out, again, how to persevere through that tangled web and figure out how to get to that outcome that you're looking for. And the more educated that people become, I mean, I think that's really the goal of what I want anybody to take away from this conversation is make sure you get educated, make sure you understand how to utilize your benefits, make sure you understand who to talk to when you don't know where to go or what the next step should look like. Forge those, relationships now while you have a chance before something comes up and you've realize, oh man,
catch up.
Yeah, I'm behind the 8 ball. I'm really trying to figure out what do I do to figure out where to go.
Yeah.
So how would you recommend taking the first steps to start educating yourself on what levels of care you have, or what access to levels of care that you have?
You brought up a perfect point. So you spend time in your HR person's office.
Yep.
I think everybody should do that. I think you need to start by, go to your employer, talk to your HR provider and say, explain my benefits to me. I mean, I think a lot of us, I know I've had it happen in the past where you're in a room, you're on your first couple days of orientation or whatever, you get this 5-page document that talks to you about your insurance. How many of us read that? I didn't even read mine.
I didn't read mine.
So
I read none.
take the time, educate yourself, look up your benefits, see what they are, see what they cover, know what your cost of care is going to look like for whatever type of treatment you might need. And then next thing, go on the website of that insurance company, call the insurance company, talk to them about your benefits and about, hey, if I were to need, like most people know what they're probably going to need. Like if you have a family history of cancer or a family history of, heart disease, you have potentially an addictive personality, whatever the issue might be, call them and talk to them about that. Like, hey, if I were faced with this type of a situation in the future, what would be my next steps?
Yeah.
And then, so what about for some people that might not be employed, right? People that might be between jobs or really, really struggling. What's kind of that next? Sorry, were you going to say something? What's kind of that next step for educating yourself, getting that access to care, that kind of stuff?
Yeah, I mean, I think it's important whether you're employed or not that you understand what type of options are available to you. Yeah. If you're unemployed and so you don't have insurance, if Cobra is not even an option for you because of the cost, then what you want to do is go online to in Washington, you have Apple Health and you have all Medicaid plans and different things like that. If you are a single person, the decision is maybe a little bit easier because you can just go on and make sure you get yourself covered. Now, if you're somebody who's trying to support a family and you're unemployed, there are options out there. If you go on the Washington Medicaid website, and for folks in Idaho or other states, typically the Medicaid websites can give you at least a good foothold into what's my next step to getting some kind of care and coverage. Because there are a lot of community-based providers that provide access to treatment or care, but they do require that you have some kind of health insurance most of the time. And so even for folks who are unemployed, there's usually an option out there. It's maybe not the best option. You're not going to get that Cadillac health insurance plan. But you can get something.
I'm still trying to get that Cadillac insurance plan. You know what I mean?
Maybe not just go for the
that Cadillac.
Damn, $25 deductible.
Oh my God, that sounds amazing. It's $25. Holy crap!
I guess I'm spoiled because when I was working with the state, I just I had state insurance.
My roommate's a paramedic and he works for the county, and he has zero deductible.
Yeah, all my medications were free. All checkups, visits were free.
Yeah. Well, in Seattle, there's a lot of grassroots programs too that are trying to help people who are homeless, and just to get out, mix in with those people in that population in that moment and identify what their major, needs might be. And a lot of time it is mental health. I think I heard a stat somewhere and, 85% of statistics are made up on the spot. I think it was 80% of people who are homeless, I think it was in the Seattle area, have some form of mental illness. And so that right there is a massive barrier to them accessing good care.
Well, and I'd be willing to bet money that, you all right?
Yeah, I'm having a seizure. Just mind your business.
I'd be willing to bet that the other 20% also have some sort of medical debt or something that is causing them to be homeless as well.
Absolutely.
So,
yeah.
Okay, so then what are kind of the next steps to make treatment more accessible at a provider level, a state level, federal level? I know that's three large questions.
Yeah, definitely big questions.
We take them one at a time.
We touched on lobbying. I mean, I think, you got to follow the money. Right. I mean, not a lot happens without some kind of resource to make it happen. Yep. And so you start with the lobbying efforts. You talk to legislators about the needs in the community. And a lot of communities do a community needs assessment. That's part of their city planning and things like that. Every year, every couple of years, they have to do this community needs assessment. And not-for-profit, especially not-for-profit hospitals, have to do a community health needs assessment. And in that, it sort of informs them where the biggest challenges are in their marketplace. And, it's kind of the same all across Washington. I would guess the rest of the nation as well, that mental health is the one thing that has gone almost completely unmet. I mean, the needs have gone unmet. Yeah. And it's because it's costly, it's not pretty, it's not easy, it's not fun to do.
Well,
it's very individual.
And there's no cure.
And there's no cure. Yeah, exactly.
There's no end
box to check.
Well,
we accomplished this.
Before I got to Northpoint, I worked as an assistant, an assister for people with mental health. They're called CBRS workers in Idaho. So And it was purely working with people that are highly schizophrenic.
Okay.
So, like, you're not doing it. Like, I would literally get in my car, drive to a group home where their family or loved ones had, like, kind of pushed them off, would help them budget, clean their room, shop, and then just talk. Like, just hang out with them. Just kick it with them. But, like, every single one of them were so unstable. And, like, there's no end goal. It's not like you'd pray and kind of cross your fingers that you're coming in and it's going to be a good day. But, like, every day it was just, like, hallucinations, audio, visual, like medications were being neglected, wouldn't follow a budget. Like, people don't want to put up with mental health.
It's difficult.
It's extremely difficult. But when it's left unchecked, like, nobody wants to deal with that. It's just kind of like one of those things, like, it's like driving by a homeless person.
Yeah.
Like, you see them, but if I don't make eye contact with them, then nothing's there. If I don't acknowledge them, then it's not going to affect my life at all. And that's how American society has treated mental health. If I don't look at it, then I can just continue in my lane and somebody else will deal with it.
Yeah,
or
somebody's going to handle it.
Yeah.
Somebody will take care of it, right? But I think we've become at this point, I think, in our nation that, like, it is reaching a critical mass. And a lot of it has, been because of substance use disorder compounding the mental health crisis.
Well, I think we're seeing more people in more prevalent roles deal with more issues.
On a personal level.
Yeah, and so it's not just like these people in the ivory white towers that we're looking at were like, help us. Like, those people are up in those towers, like, dealing with their own substance abuse and mental health and stuff.
Yeah.
They're no longer untouchable.
As awareness grows to the problems and it impacts more people who are in a position of power to be able to make action happen, I think that we'll continue to see better and better access become available. Also, just kind of like destigmatizing mental health and substance use will definitely make an impact, because when it becomes viewed as just any other illness, then it becomes more normalized for folks to provide resources to it to support it. And I think that's where we're going now.
Yeah. Well, and I also think, so we've talked a couple times on this trip about social media and media in general kind of adding to that stigma of addiction and mental health. But I also think now it's starting to kind of swing back the other way, and there's been actual real representations of what alcoholism and addiction and mental health look like. And I think that's going to be a trend going forward, and that'll raise more awareness, because I mean, as much as I wish it was the case, people aren't super stoked on going out and educating themselves in, like, traditional ways. And normally it kind of has to happen through kind of pop culture in some way. And I'm seeing that trend. Maybe not. I mean, I'm sure there's both ends of that, but I've definitely started to see more shows, movies, books that are talking about, like, real reality of when it comes to mental health and addiction. So I think that's good.
Yeah, absolutely. And pop culture, you're right on when you say that. When you see enough movie stars and things coming out and just openly admitting their own struggles with addiction, that is something that I think does move the dial.
Okay, so I feel like we touched on the state and the federal level. Is there anything that, like, at the provider level specifically, right? Because that's where we're at.
Right.
So what are things that maybe Northpoint is doing or will do or needs to do that makes healthcare, more treatment, more accessible?
Yeah. So our marketing and our outreach efforts, I think, are actually having an impact in the Seattle area, the greater Seattle area. So where we're on TV, occasionally the radio. We go deep with our marketing. But it's not marketing from a business perspective. That's not the goal. The goal is really that educational piece, to say there is a service that's being provided near your community to help you with your issue. And so I think that the more of that we do, the better. And the more awareness that there is in the greater Seattle area to what services are available, that's going to help a lot. We had a piece run in the Seattle Times. We've got a couple more that are going to be coming out. It is paid advertisement, but it's educational. I mean, that's the intent behind it. It's not to make somebody say, I'm going to go to Northpoint for treatment. It's saying, here are options for treatment. Here are the types of things that the questions that people should be asking you if they care about you and care about making sure you receive access to good health care. Sure. And so we're just going to keep running those types of educational articles. Like it. We're going to keep putting our TV ads and things out there showing that there is treatment in your area.
Going deep.
And just go deep on that marketing.
I love it. I know you kind of already talked about what you want people to take away from this and kind of educating themselves. Is there kind of any last words you want to leave us with?
I think just, touching on like what we talked about before, persevere, know your plans, know your providers in your area, make sure that you know what your family could have for access to care. And, the only person you can blame at the end of the day if you don't do that is yourself. So, take it upon yourself, get educated, and make something happen for when you need it.
I like it. John? Not even going to make a joke?
Seahawks suck.
Guys, thanks for joining us. Logan, appreciate you being here on a Sunday.
Yeah,
we really
appreciate
means
it,
a lot
brother.
to us.
I know you didn't feel too well either, so I appreciate you coming out.
It's all good.
Wouldn't have been able to tell until he said something.
I mean, I'm all about pointing out the obvious.
Guys, make sure you educate yourself, like Logan said. Spend time with your HR person. Get online, do some Googling, all that good stuff. Make sure you hit that like button, that subscribe button, that share button. Tell one person that you think would get some value out of this episode. We're really trying to share those tools used to achieve recovery. Stumbled through that. Guys, it's been No Way But North. We talk about the miracles of recovery and the tools used to achieve them. Thanks.
Peace.
If you or a loved one are struggling with addiction, please call 208-999-4064. The views and opinions expressed in No Way But North do not reflect those of Northpoint Recovery or any other institution or organization.